Some countries like the US have started vaccinating 12 to 15-year-olds, and they are hoping to vaccinate younger children later this year. Other countries like Singapore have announced that they will be vaccinating this age group imminently. As parents, we all have the same question. Is the COVID-19 vaccine safe for my child, and do they really need it? I'm Dr. Gina, and in this video I'm going to tell you everything you need to know about the COVID-19 vaccine and how it impacts children. I will give you 5 key evidence-based facts that will allow you to decide if vaccinating your child is the right thing for you to do. Currently, over 170 million cases worldwide have been reported, and the death toll currently stands at just over 3.7 million deaths. Many countries have published data on their COVID patients, and from meticulous research and data collection, the following key facts about COVID-19 and children have been determined. 1. COVID-19 appears to affect children less often. The good news is, your child is less likely to contract COVID-19 than you are. Numbers vary, but children make up less than 10% of total cases in the US. 2. COVID-19 infection is less severe in children. Fewer children are likely to be severely affected compared to adults. The majority of children have mild symptoms or no symptoms at all. We know from hospital data from multiple countries that children are less likely to be admitted to hospital with severe symptoms. This data showed that only around 1% of children with COVID-19 were severely impacted during the first wave of the pandemic. However, children less than 1 year of age and older adolescents are at much higher risk than other children. 3. Children can transmit COVID-19, but not as much as adults. Children are more likely to be asymptomatic carriers of COVID-19, so they can infect others. Data from schools show that the risk of transmission is low for younger children, although the exact transmission rate is unknown. However, due to the role that children play in spreading COVID-19, children will need to be vaccinated in order for a country to achieve herd immunity. 4. Babies born to mothers who have COVID-19 infections seem to do well. Many of you watching this video may be expecting a baby, and you'll be worried about the implications if you contract COVID-19 whilst pregnant. The good news is that a large number of babies have been born to mothers positive with COVID-19, and generally the babies do well. Evidence shows that the virus can transmit to the baby from mother during pregnancy, but rates remain low at 2%. Healthy babies do well, but those babies who are born with other conditions, such as lung, heart, and neurological conditions, are more likely to need intensive care support. However, this would be expected for any respiratory infection in these children. 5. COVID-19 can cause a rare but dangerous inflammatory condition in children. Unfortunately, it's not all good news. Multiple countries have described and reported incidents of a new rare hyperinflammatory condition in children as a result of COVID-19. It's called PIMS-TS, Pediatric Multisystem Inflammatory Syndrome in Europe, and MIS-C, Multisystem Inflammatory Syndrome in children in the US. It causes inflammation of vital organs such as the heart, lungs, kidneys, gut, and other organs, which can cause the body to shut down and lead to death. Many children have recovered, but there is an increasing number of deaths being reported. The symptoms that you as parents need to look out for are a fever lasting more than a couple of days, a rash, which can be anywhere on the body, bloodshot eyes, the white of the eyes may look very red, gut symptoms such as tummy pain, vomiting, or diarrhea, swollen lymph nodes in the neck that you might be able to feel, red cracked lips, and a tongue that might look more red than normal. We call this a strawberry tongue. There may also be swelling of the hands or feet. Now, many of these symptoms occur with other viruses, but you should take your child to see a doctor if they develop any of these symptoms, especially if they've been in contact with someone who was tested positive for COVID-19. Most of these facts are reassuring, and the data so far on children has been more positive compared to adults. However, we are seeing more and more mutations. What we don't know yet is how these new mutations or future mutations will affect children. It could make them more sick, there may be a high transmission rate, and the current vaccines may not be as effective against these new mutations. COVID has impacted all of us, but for children it has completely turned their lives upside down. It has impacted every aspect of their lives, including their mental health. So what needs to happen for life to go back to normal? Current COVID-19 vaccines have proven to dramatically reduce the transmission and severity of infection in many countries. However, for life to truly get back to normal for us and our children, we need to achieve herd immunity. This requires a high percentage of the population being vaccinated against COVID-19. Pfizer and Moderna commenced clinical trials in children less than 12 years of age in March 2021. So far, vaccines have been very effective in the 12 to 15 year age group, showing they have a better antibody response than adults. We know that children's immune systems are better at fighting off new viruses than adult immune systems, and it appears that this may also be true for COVID-19. Vaccine trials have also commenced in children less than 12 years of age, including children as young as 6 months. Vaccine safety is of the highest importance, and vaccine companies will be tightly regulating and monitoring for any side effects, and also the implications of administering vaccines alongside routine childhood vaccinations. For example, there have been some concerns recently regarding possible increase in blood clots with some vaccines for adults. Vaccine companies will be closely monitoring children for this and any other unwanted side effects for months and years to come. It is likely that as more mutations develop, vaccines will also need to evolve to keep up with the virus. It is highly likely that we will need booster COVID vaccines to remain immune in the future. So in conclusion, the COVID-19 vaccine for children is being developed and tested right now. Children will need to be vaccinated for populations to achieve herd immunity. Children over 12 years of age have already been vaccinated in some countries, and the data so far is very reassuring. Infants less than 2 will be the last to be vaccinated, and only after extensive studies are completed. All children will be closely monitored for side effects. There is a lot of fake news circulating around on social media. Please ensure that you only read and share information that is factually correct and based on evidence. Misinformation will only slow down the progress that we are making in this fight against COVID-19. Here are some further resources if you require more information. I hope you found this content useful. Dr. Gina Parenting is an evidence-based learning platform which analyses the most common issues that parents face and delivers up-to-date and accurate information based on clinical research and evidence. This helps empower you as parents to make the best possible parenting decisions based on information that you can trust. To check out more videos, please subscribe, like and post a comment. And if you have an interesting topic that you would like to see covered in a video, please let me know. Thank you.